8.
And he's still.
You got it? You got it?
Ms. Grayson, call the roll, please.
Senator Beasley? Senator Bell? Senator Butler?
Here.
Senator Chastain? Senator Coleman Madison? Senator Gavan? Senator Roberts? Senator Shelnut? Senator Stewart? Senator Weaver? Senator Williams? Senator Stutts? Senator Melson?
Here. We have a quorum, 10 members present. Senator Orr wishes to carry over his bill because he has some technical amendments he needs to work on. So we'll call the next bill.
SB 80 by Senator Stutts.
Just before we get started, members, I want to let everybody know we're going to hear from the bill, the sponsor. I think he has a couple of people that wanted to speak. Nobody called a public hearing, but I'm indulging that. But we're not going to vote this bill today. We'll bring it back probably next week and vote it then. So, Senator Stutts.
Thank you, Mr. Chairman and members of the committee. I know several people want to kind of address this issue, but it's really very straightforward. Bill simply is only 2 pages long and just requires that hospital emergency rooms are staffed by a physician. And I think that is expectation of the general public. And I understand the hospital association is lobbying hard against it. I mean, I think they could have paid for several ER doctors with the money they've spent on lobbying the last few days, but they said they couldn't afford it. So anyway, I think the general public expects that. When you go to an emergency room, you expect to have somebody there qualified to take care of you. And I know emergency medicine was not my specialty, but when I was in residency, I moonlit in rural ERs for 3 years, working weekends, and worked in places like the Pickens County Medical Center and the hospital in Winfield and multiple places that were a long way from any other facility. And I can tell you that there were several times during those moonlighting experiences that had somebody not been there qualified to take care of the patient that rolled in the door, there would not have been a good outcome. I was moonlighting in Pickens County in Carrollton and had a stab wound to the chest that came in by private car. Had I not known how to put in a chest tube and intubate, there would have been, the patient would have died. And anyway, I think that the general public expects that when they go to the emergency room, a doctor's going to take care of them. And this bill, I mean, that we've tried to argue over, well, if you've got to be physically present, can they go to the bathroom? Can they eat? I mean, those kind of arguments are ridiculous. We're saying a physician has to be on the premise, primarily responsible for care in the emergency room. It's that simple, and I'll be glad to hear from the people that want to talk pros and cons on the bill.
Any questions from the members for the sponsor? Senator Weaver?
So I do have some comments, and Senator Stutts and I have talked at length about a lot of my concerns, but I'm happy to hold my comments till after everybody else.
Okay. Anybody before the? Okay. We don't have a sign-up sheet, I take it. So would you like to introduce your first speaker?
I'm not sure who, Nico, did you want to say anything, or who's here from the emergency medicine physician group? Okay, there you are. Come on up. I didn't know, couldn't pick you out of the crowd.
And say your name and what your occupation is. Go ahead.
Members of the committee, thank you very much for the opportunity to speak.
Is that mic on?
It doesn't sound like it's on. Let's see. It's on the 0.
Can you come up and assist him?
Oh, here we go. I think.
There we go. Thank
All right. Excellent.
But he can put in a chest tube.
That's right. And I can turn on a mic. Yeah. Well, thank you very much for the opportunity to speak. So as I said before, I'm Dr. Sean Van Landingham. I'm an emergency physician. I work regularly in rural emergency departments throughout the state. I'm president of Alabama ACEP, and as a part of that, the last 2 years, I've made it a point to try to work as much as I can in various hospitals throughout the state, just to kind of learn about the state of medicine in Alabama. So before I begin, I want to be clear, this is not an argument against nurse practitioners or physician assistants. They are essential members of the emergency care team, and they are also our partners. In larger emergency departments, they provide excellent care for low acuity and urgent care type patients. But they are not prepared to independently manage life-threatening emergencies. And the difference is training. So physicians complete 4 years of medical school, 3 years or more of residency, and they accumulate 12,000 hours or more of supervised patient care. By comparison, nurse practitioners in their training program typically complete about 500 clinical hours. That's less than 1/20th the training of a physician. And that difference, it matters most when patients are critically ill. For example, major trauma, septic shock, respiratory failure, obstetric emergencies. These are low frequency but high risk situations where decisions must be made quickly and often with incomplete information and without immediate specialty backup. When emergency departments operate without a physician present, patient outcomes suffer and disparities increase. This is especially true in rural hospitals where there are no surgeons, there are no OBGYNs, no other specialists, no other doctors to provide backup. Allowing unsupervised emergency care in those settings, it creates two different standards of care that's based solely on geography. This concern is shared widely within the medical community. Last spring, the Medical Association of the State of Alabama reviewed this issue and passed a resolution without any objection to support 24/7 physician presence in emergency departments. They recognize the patient safety risks of non-physician-led care. I want to close with a brief story. I've shared this privately with some of you, but I think it bears repeating. So a few weeks ago, I was working alone in a rural hospital. It was just me and a few nurses. It was a very quiet morning. It felt like an urgent care center. We had cough, flu, ankle sprains, kind of those types of things. But then at 12:30 p.m., a patient with a gunshot wound came in. It was a woman shot in the chest. Her blood pressure was 60/40. She was pale. She had lost a lot of blood. She was unresponsive. And myself, with those nurses, we resuscitated her. I intubated her. I put in a chest tube, activated a massive transfusion protocol. And as happens often, she couldn't fly. The weather was bad. We couldn't get a helicopter. So she had to be stable enough to be able to ride on an ambulance for 2 hours so that she could get to UAB and get definitive care from the trauma surgeons. She did that, and she lived. And I believe that she lived that day because a physician was there. So these emergencies are unpredictable. They happen every day, at every hour, in every corner of our state. Alabamians deserve emergency care that meets a minimum standard, no matter what their zip code. And so we respectfully urge you to support this bill. Thank you.
Any questions from the members? Senator Roberts.
Doctor, thank you very much for being here, and great job on that. How many ER hospitals are there, emergency hospitals, and how many do not have a physician present? Do you have any idea?
Yeah, I don't know how many total. I've only heard of 2 that don't have a physician present 24/7. There could be more. There's not really any kind of mechanism for tracking this data that I'm aware of, so I don't know.
Anybody from the Hospital Association know that number? I've heard anywhere from 5 to 15. I don't know what the number is either. 4. Okay. All right, any other
May I
members?
do a follow-up?
Sure.
Of those 14, are they within a certain radius or anything like that? I'm just trying to understand.
They're all over the state. There's the critical access hospitals, rural emergency hospitals. I didn't plan on speaking, that's why I apologize for that up. But just about 14 that we're talking about that are not here.
Can you look up that information, how close they are to another?
Yeah, we can pinpoint that and get more data.
Thank you. To another ER.
Mr. Chairman,
I was going to see if Senator Roberts, okay, Senator Stutts.
I had a follow-up question. When you get that information, could you also include in that how many hours of the day that is when you say it's not 24/7? Does that mean 20 hours of the day, these 14 places never have a doctor there?
I misunderstood. My answer was that all of these hospitals provide 24/7 coverage with someone on site. I was giving you the total number of the ones that we're talking about in general.
Yeah, well, who are the 14 is what I'm asking. Is that,
They provide 24/7 coverage with an MD or DO all times, 24/7.
Okay.
yeah, they do now? Okay, so I guess what I'm not understanding then is how many places in the state currently do not have a doctor in the emergency room when the emergency room is open?
I'm not aware of it. Now, there may be a particular time, 15 minutes, somebody leaves to go to a nursing home down the street. There'd be many issues that where they leave the building, leave the premises, but they're covered.
It's kind of like Georgiana. When I used to work there, they'd give me a beeper and say, we'll call you if we need you. Is that kind of? And if a turkey was gobbling, it was frustrating if they called me, by the way. It was, yeah. Okay. Anybody else want to speak for ER docs?
We have one more.
Yeah. I didn't know if he wanted to speak. Come on up. Just state your name and your practice and.
Sir. My name is Jaron Raper. I'm an emergency physician in Alabama as well. And I'm also here in support of this bill. In addition to the effects of individual patient welfare that Dr. Van Landingham has already touched on, I'd like to address concerns that the legislation could force hospitals to close, especially rural hospitals. That concern deserves serious consideration because our goal is to protect rural health care, not to eliminate it. So I'd like to start by addressing what's happened in states that have already enacted similar legislation. South Carolina, Indiana, Virginia, they've all passed physician presence requirements beginning in 2023. To date, none of those hospitals in those states have had to close as a result of this legislation. In other words, the concern is understandable and certainly one that we've considered, but it's not been borne out in practice. It's also important to understand what happens clinically when physician expertise is not immediately available. In complex high acuity cases, physicians with less training are understandably going to be a little less certain. And that uncertainty often leads to more testing, more labs, more CT scans, more transfers, and ultimately more downstream costs. Those costs are real and they're going to be borne by the patients as well as the hospitals that care for them. Now let's talk specifically about rural hospitals. When a hospital converts to rural emergency hospital status or REH status, it receives about $3.5 million per year in support from the CMS. In exchange, inpatient services close, and the hospital, in shuttering those inpatient services, focuses almost entirely on emergency care. Those funds should more than cover the cost of physician coverage 24/7. The model was designed to preserve access to emergency care, not to operate without appropriate medical oversight. And as many of you are already aware, Alabama, not the federal government, has already addressed this issue in another setting. Freestanding emergency departments in our state are required to have a physician present at all times. Functionally, there's very little difference between a freestanding ER and a rural emergency hospital. Both exist primarily to provide emergency care, often with only one healthcare provider on site. So the question really becomes simple: why should a patient who walks into a hospital receive a lower standard of emergency care than a patient who walks into a freestanding ER? I'd like to close by asking you to imagine what you would want for someone you love. Forgive me, but I'm going to ask you to imagine that your loved one is having a medical emergency. A stroke, maybe a heart attack, maybe a car accident. You may be driving down the interstate and see the big blue H. Maybe you pull up and see the emergency sign, and you probably have some expectations about the care that your loved one's about to receive. You would reasonably expect that if your loved one needs a physician, they're going to be in the right place because you brought them there. You should be able to expect that if your loved one suffers a cardiac arrest, a massive blood clot, a hemorrhagic stroke, a physician will be there ready and able to treat them immediately. This bill helps make sure that expectation matches reality. And if you're unsure about anything I've said today, I'd encourage you to call the family member you thought of just now on your way home. Ask them what level of care they would expect in an emergency. Ask them whether they want a physician present. On behalf of Alabama emergency physicians and the patients we serve, I urge you, please support the bill.
Any questions for the speaker? Thank you very much.
Committee.
Members, again, I stated we weren't going to vote this today. We'll vote it probably next week. And, yes, Ms. Weaver?
I do have some comments. I did not have questions for the speaker, but I do have some comments, so I'll save them to later if you prefer, if you'd like for me.
Feel free.
First of all, I'd like to say to the ER doctors, I want to thank you for the work that you do, and my comments are absolutely nothing in relation to the work that you do. I'm a big fan of ER doctors. I have a special place in my heart for them. So thank you for the work that you do. I have a big problem with this bill, and Senator Stutts and I have had conversations about it. I don't have a problem at all requiring it for urban hospitals, suburban hospitals. I do have an issue with rural hospitals and critical access hospitals because we are requiring them, if we pass this bill, we are making them have a regulation that the federal government does not make them have. So why would we have stricter regulations than what's coming down from the federal government? And I guess I'm coming from the standpoint of, for the past 7 months, I've been doing work with this Rural Roadmap Initiative for Healthcare, and we have looked at it from all angles of what we can do to keep rural hospitals open and keep rural health care wonderful and available for its citizens. And to impose another regulation like this in a time where our money is already tight, I can't support this bill, and I just have a problem with that. And it comes from my experience of when I worked in a rural setting. There were different situations, and Dr. Stutts and I have talked about this, but, there was a situation where the ER doc may have to go to the nursing home to pronounce someone dead, or he may have to run across the street real quick to the specialty clinic for something. And this on-site here, it would be against the law in a situation like this when there's that one provider there that's doing multiple jobs while he's also taking care of the ER. So for that reason, I cannot support this bill. Again, it has nothing to do with the ER doctors that are here. I appreciate you, appreciate the work that you do, but I can't support this bill.
Any other comments from the members? Senator Beasley?
I guess I addressed this to Dr. Stutts, maybe from one of the ER doctors. I just wonder, when you have a doctor on site in the ER, how many nurse practitioners do you have? How many physician's assistants are available? Is it just one doctor, or do they have a team? I think that's a pretty important factor.
I think it varies from facility. So it'd be hard to say.
No rule of thumb.
Yeah, but if you could get with them and this information would be great. And Senator Coleman Madison, did you have a comment?
Yes, sir.
I was going to answer his question, and I think you appropriately answered it. Hospital I just retired from, they had 2 doctors there during peak volume hours. During slower volume hours, they had 1 physician present, and then some physician extenders, whether they be PAs or nurse practitioners also. But they had 1 or 2 doctors physically present.
Thank you.
Senator Coleman Madison.
Thank you, Mr. Chairman. I apologize for being late, but whilst listening in, first of all, Senator Stutts, I appreciate you bringing this bill, because there is a level of expectation. When you go to a hospital or a medical facility, you expect that a doctor would be there. May not be in all over the place, but you expect to see a doctor. I know I went to a minor issue for what we call the doc in the box. Nurse practitioner was the one that waited on me. Great service. I'm a great proponent of nurse practitioner. She did a great job. It was something that the insurance would have taken care of, would have paid for, but because she signed off and the doctor didn't sign off, I got the bill. I'm a patient. I don't know what goes on behind the scenes. Wouldn't have had that problem had a doctor been on site. The doctor could have signed it. But the reason that I support this bill is the fact that we talk about a level of care and regulations. Regulations. How do we weigh regulations with a person's life and health? So we're saying, well, the federal government doesn't require us to do that. So why would we do that? If it was my loved one, I could give about what the federal regulations is. I want the care. And I think all of us sitting around this table would feel the same way. And so if we are going to be about caring about our citizens, if we are going to be about, we've gone through this thing with healthcare of trying to find from regional organizations to right now we're getting this federal money in that's going to focus on the rural areas, and this is really where this is going to be impacting. I'm in Jefferson County. We have a hospital pretty much in kind of like stone's throw. We are very fortunate. But when rural counties or these small hospitals are not able to care for their patients and they don't have a doctor on site, naturally they have to transport them. Whereas if you did have a doctor, would be able to do certain things, sign off on certain things, if that person was in place. And again, what price do you put on your family's care? That is the question.
Well, members, if you have issues with the bill, please talk to the sponsor. Please plan on having this discussion. And Senator Stutts?
Let me address one thing, and Senator Weaver and I have had multiple discussions about it, and she said she had a soft spot in her heart for emergency room doctors. Said she's married to one, so I hope she does. But anyway, as we look at the language in this bill, you know, and you said the physically present on site. I mean, if the intent is to make the doctor available. I mean, we can talk about, you know, maybe saying immediately available, you know, and that takes away this argument about can the doctor leave the ER long enough to go to the cafeteria, you know. I mean, in the real world, that's not even an issue, but, you know, if you're comfortable with that, I'm not, you know, exactly married to exactly the wording here, but the point is an ER doctor's got a physician. It doesn't have to be board certified in emergency medicine, but a doctor should be there and primarily responsible for what goes on in the ER if the ER is open. And I understand if you say, well, we can't do that, well, then maybe you don't need to have an ER. But still, I'm open to talking about the language of the bill before we vote it next week.
I'll come have a conversation. I'm sorry, am I recognized?
You are recognized.
So again, I just have a problem with the bill as it's written. I think that your intent is good. I agree with Senator Coleman Madison in that patients expect quality care when they go to receive services. And I think that there probably is a way that we can have some conversations to get to a point where we're all good. But I just don't think it's right here in the way it's written.
Yep.
Thank you. So y'all going to take your laundry back to the offices to air it out then? All right. Thank you. We're dismissed.